Welcome, everyone. Thank you for joining us today. I'm Teresa Marantat, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. We want to remind you that public health messaging remains the same regardless of the stages of reopening. Stay home if you are sick, maintain a 2-meter distance from others, wash your hands often with soap and water or use an alcohol-based hand sanitizer, use proper respiratory etiquette by coughing into a tissue or your sleeve, and wear a mask when attending commercial establishments. For area businesses, visit our website to access our Safe Return to Business Toolkit. This toolkit includes checklists for various sectors, common FAQs, and additional resources and signs for your businesses. We have received questions about any restrictions of travel between communities in Stage 1 and 2. To confirm, there are no restrictions in place. If you have further questions, please email us through our website. There are 102,622 confirmed cases of COVID-19 in Canada and 34,205 cases in Ontario. Chatham-Kent has 157 cases, and Sarnia-Lambton has reported 285 cases. Michigan now has 62,306 cases, with 11,492 cases being in Detroit. Today, we are reporting 1,374 cases of COVID-19 in our community, an increase of 5 cases from yesterday. 1 person works in the agri-farm sector, and 4 are in the community. 839 cases have now resolved. 453 people are self-isolating. 22% of our cases are between the ages of 20 and 29, and 21% are between the ages of 30 and 39 years. 58% are male and 41% are female, with 1% unknown. Our community has lost a total of 68 people to COVID-19. 49 deaths have occurred among residents in long-term care and retirement homes. There is 1 long-term care home currently experiencing a COVID-19 outbreak, and there are 6 workplaces in the agriculture sector experiencing a COVID-19 outbreak. Symptoms of COVID-19 range from mild to severe. Some common symptoms include a fever, new or worsening cough, a barking cough, chills, sore throat, and shortness of breath. Call 911 if you have difficulty breathing and are struggling to breathe or speak, or experiencing severe chest pain, or if you are feeling confused or losing consciousness. Please be reminded that Windsor-Essex has 2 COVID-19 assessment and testing centers, Erie Shores Healthcare in Leamington and Windsor Regional Hospital Olette Campus. SOHAC, the Southwest Ontario Aboriginal Health Access Centre in Windsor, also offers testing for First Nations, Métis, and Inuit people and their families. Please continue to visit our website at reachu.org for the most current information and case counts. I will now turn it over to Dr. Ahmed, our Medical Officer of Health, for his update.
Good morning, everyone, and thank you for joining us again. The decisions and recommendations we always make in public health are based on the science and evidence and is always considered the safety and well-being of everyone. The focus of each and every recommendation was to ensure that the recommendation is made in the best interest of the community and would not lead to any unintended consequences. So just like every Friday, we'll jump into our weekly epidemiological summary. Very quickly, this is what we will cover. We'll focus on the key points to answer some of the questions everyone including us, to help us guide with our decision-making process. The epidemic curve or EpiCurve help us to assess the progression of the disease, whether we're talking about in the community or in any kind of outbreak situation. This particular EpiCurve is created to show the confirmed number of cases by symptom onset date. On your vertical axis, you have number of confirmed cases, and on your horizontal axis, we have the date these cases started to show symptoms. The significance of using symptom onset date instead of the case reported date is to get a sense of when the disease transmission or exposure is happening. This particular graph includes all the cases in the community, whether we're talking about community cases, long-term care homes, retirement homes, and also cases in the agricultural sector. Please note that the data presented in the shaded area may not be reported yet to public health and may not be entirely accurate and subject to change. We can see that there has been we're looking at a decline in the number of cases in the last couple of weeks, but in the shaded area, but just be mindful that there may be other cases that have not reported to us. Sometimes these variations are difficult to capture in this type of graph, so for that purpose, we can use a different way to look at it, to look at the 3-day moving average. The 3-day moving average helps to capture some of the day-to-day variation and present a much better picture. Same idea, what we can see is we have seen a decline in the second and third week of April, and then we start to notice some increase in late May and early June, and then we are starting to seeing a decline again. Breaking it further down to cases by long-term care home, retirement home, community acquired, and also in the agri-farm sector. We can see a spike in the last third week in the month of May among those working in the agri-farm sector. Please note that the orange bar includes both individuals who are temporary foreign worker and those who are residents of Windsor-Essex but work in the agri-farm industry. The bulk of the cases in the last month, as we can see, is among the agri-farm sector, while the community cases are continuing to show a declining pattern overall, with very few long-term care home and retirement home cases. So if we remove the long-term care home and retirement home cases and as well as agri-farm cases, this particular epi curve shows a continuing declining pattern in the community all the way up to this point. We have seen a spike early in the last weeks of March, but since then our community has done extremely well in maintaining and following most of the physical distancing, hand washing, and following public health recommendation, and that has probably led to the decline in number of cases and also protecting the entire community, healthcare system, saving lives, and also reducing the spread of the disease. One of the other way to look into it, that how we are doing, is using a 7-day moving average instead of a 3-day moving average. The blue line looks at the number of cases using a 7-day moving average overall that includes everyone in our region. We see a peak in the late March and in April, and then in April it was mainly attributed to the long-term care home. What we are looking in June is primarily attributed to all the cases in the migrant farm industry. If we remove the migrant farm industry from this particular graph, what we can see is with the green line, it continues to show a steady decline, and our average 7-day moving average outside of that industry is pretty comparable or even better than what we are seeing in the province. This particular slide captures the week-over-week incidence rate per 100,000 population from week 18, that is April 27th, to our current week, which is week 26. We have seen a dramatic increase in the cases in week 24, which are primarily attributed to the agri-farm sector, and the trend is moving in the lower direction, where the case counts are coming somewhat to before we start to see that spike in the agri-farm sector. Looking at how we are comparing with the region and the province, Windsor-Essex has the 4th highest rate in the province, and our rates are higher than the provincial average. For us here locally, we know that we have experienced a higher proportion of cases in long-term care home and retirement home. Currently, it's at 22% of our cases were attributed to long-term care home and retirement home, but there was a time when it was peaked around 42% of our total cases. And those 42% were included all the staff and residents in the long-term care home and retirement home. Currently, we are seeing an increase in the number of individuals, cases in the agri-farm sector who are ill, and they now constitute 35% of all cases. We also know that all this high number of cases in the agri-farm sector is because we have a large number of farms, which is contributing to the increase in the number we are seeing. Windsor-Essex is home to at least 8,000 to 11,000 of temporary foreign workers in any given time. Looking at the age and sex distribution of many of these cases in our region, what we still see is in the last overall overall, we have seen the higher number of cases in male compared to female, and that trend is continuing in the last 2 weeks as well. What we have noticed more recently in the last 2 weeks is the cases between age group 20 and 40 is constitute the most of the cases in our region, up to 60% combined together. So this is one of the reminder that we want to make out, put out for all individuals in that age group, that we have to take precautions, irrespective of the age. We know that some of the comorbidities and mortality is associated with older individuals, but these younger group or people between these ages can also be a significant carrier of the disease, can spread it easily in the community, and can also infect other people who are in the high-risk population. So this particular graph shows the distribution of cases, COVID-19 cases by all the municipalities. Currently, 41% of our cases are from Windsor, and the rest are from the county. We are seeing almost 31% of our cases from Leamington and 18% from Kingsville. And this is mainly due to the uptake in the cases in agri-farm sector in the last month or so. Breaking it further down to cases by municipality in the last 30 days, we can see that in the last 30 days, 50% of the cases are coming from Leamington, and 33% of the cases are from Kingsville. And let me just put another reminder that all these cases are mainly from the agri-farm sector and not necessarily from the community. Breaking it down further, in the last 7 days, we have seen a spike in the number of cases in Kingsville area, with that constituting now 55% of all cases, and Leamington constituting 31% of the cases, while the rest of the county is showing almost no cases to very few cases overall, with Windsor constituting 13% of all cases in the last 7 days. If we are focusing down on the last 7 days by occupation, we can see 81% of our cases are from these industries, 1% from healthcare, and others are individuals that are neither healthcare worker nor agri-farm worker. So another area of interest is the exposure, that how are these individuals getting the cases, and we can see right from in the beginning of any pandemic, we can see that most of the cases are travel related, and we can see all these blue lines are blue lines representing cases resulting from travel, and then we have green lines that are representing all close contacts of these cases, and then yellow or orange line represent community transmission. From a pandemic control perspective, we want to see less and less of this yellow or orange lines. And obviously, with all these travel restrictions in place, we're seeing almost no travel-related cases, cases are mainly in the close contact or as a result of the community transmission. So with the aggressive case and contact management by public health, we can see that all these green lines are getting bigger, which means we are reaching out to all these cases in a timely manner and to providing advice for further and to reduce further spread in the community by providing appropriate isolation for all the close contacts of the confirmed cases. Just looking at some of the community exposure by reported date, most of the cases that we are seeing here now is getting less and less as we are moving into the stage 2 with most of the municipalities in the region. It is now even more than ever important for us to follow all these recommendations from public health to reduce any kind of community exposure in our region. And it can change very quickly, so please follow all the recommendations that public health are putting out to protect our community, to protect ourselves, to continue to stay in stage 2 and potentially move into stage 3. Please follow all the public health recommendations. Now focusing more on the exposure history by reported date among agri-farm workers in the past 30 days. Again, same idea, all the green bars are showing close contacts, whereas the orange or yellow bar is showing community-acquired or community transmission, where we do not really have a cause identified as a close contact. And we are, again, seeing the same pattern. Most of these cases are in close contact, and on top of that, we know these agri-farm workers, they live in congregate setting in tight spaces, and the likelihood of one person causing more cases in the same accommodation is significantly high, and that's why we have seen a huge number of cases in this group in a very short period of time. Looking at the healthcare worker status, we can see that almost 19% of our total cases in the community are healthcare workers, and out of these, roughly 23% within that 19% is a worker who traveled to Michigan. We have seen that number going more in the initial phase of the pandemic, but then with many restrictions, travel restrictions, public health guidance, that number started to go down, and we're seeing more and more cases locally and mostly in the agri-farm sector, which is also something that we see in any kind of pandemic spread, that the cases now moving towards the workplaces settings. Another question that is frequently asked that if any of these individual cases had underlying chronic conditions. The majority of them, up to 70%, did not report any chronic or underlying immunocompromised conditions, whereas 30% of the individuals are reporting some kind of a chronic condition, either whether they're immunocompromised or have any other type of medical condition. Some of the common symptoms that are still being reported is cough in 68%, followed by fever, malaise, and fatigue. Please note that all these cases, some individuals will report more than one symptom, so the numbers will not add up. Looking at the hospitalization and ICU for COVID-19, in the last month or so, what we have seen is a steady decline in the number of cases of COVID in the hospitals and ICU beds, which is, again, correcting that our health system is capable of addressing any potential surge if we see in the community. That is also one of the indicators that the province looked for when making any decision about moving stage 1 to stage 2. Please note that it is still important that whatever we are seeing, it's because of all the continued effort that we have done, and we need to continue to keep doing what we are doing to keep us in the same state. Now is not the time that we start to lose our guards and start seeing some of the spikes in cases, and something similar that we are seeing in the United States. So please note that moving to stage 2 doesn't mean that the COVID is gone from our region. It is now more than ever, because there will be more possibility for people coming in close contact. There will be more possibility that people will be have some difficulty in maintaining physical distancing. Please follow all those guidelines that public health has put out. Maintain physical distancing, and more importantly, if you're sick, please home and get tested. Looking further at the health system capacity, right now we are seeing that our acute care beds are at somewhere close to 80-85% capacity. The green and dark blue lines are ICU capacity and ICU ventilated beds, and what we are seeing is we're seeing a steady number where there is no threshold for the ICU. Anything that's less than 50% can be considered as doing good. Looking further at what's happening with the cases, close to 60% of our cases are currently resolved, 35% are still self-isolating, and we're with a very limited number of cases in the hospitalized or in ICU setting. Unfortunately, we have lost 5% of our cases to COVID. Among those lives that are lost, what we are looking is overall more female died with COVID diagnosis compared to male. From an age distribution perspective, almost 70% of the deaths were in individuals that were older than 80 years, and the youngest person died in our region was a man in his 20s. So comparing ourselves with the province from a case fatality perspective, what we are seeing is in overall our community case fatality rate is 5%, which is a decrease again from the last week. If we compare it from the provincial perspective, so overall province case fatality rate is 7.7%. So in some way, we are better than the provincial average, our provincial rate, from a case fatality perspective. Similar idea, when we are looking for the long-term care home and retirement home, our case fatality rate was 16.3%, while the provincial average was 22%. Looking at the doubling time, this is a cumulative comparison. So we are looking at the flattening of the curve in our graph here, while the cases are now exceeding more than 6 days to double up. Looking at a day-to-day comparison, we have seen some spikes in our region, and in the last week, we have seen the numbers going down significantly compared to the provincial average in the green. So the blue line is showing our local average, and right now, in the last couple of days, we are doing better than the provincial average. But again, these are day-to-day variation, and which change significantly. Looking at the mean R naught effective, the most recent estimated mean is 1.01, and the R naught is based off the symptom onset date. When the R naught is greater than 1, each existing infection is basically causing more than one new infection, which could lead to a higher infection rate in our community. Our R naught estimate has increased recently due to the cases in the agri-farm sector, but when the R naught is less than 1, that means every infection is causing less than one new infection, which would potentially lead us all the way into the situation where the community cases will go down to 0. So in summary, Windsor-Essex has continued to see a higher number of cases, more recently in the agri-farm sector, and the primary source of exposure in this agri-farm sector is also still through close contact with a confirmed case. COVID-19 related hospitalization and ICU capacity have decreased dramatically in June, whereas the R naught effective value is almost coming close to 1, and hoping that it will go down to below 1 to move us in the right direction. We have seen significant variation in R naught in the last few weeks because of our significantly high number of cases in the agri-farm industry. Thank you.
The conference is now unmuted.
We'll now take questions from media. We'll start with Windsor.
I have a question about, I guess, patios and that sort of stuff. The province has said that reservations are required for patios. We're seeing that a lot of places are not actually following that. Also, the health unit's guidance says that patios should not be covered and only umbrellas are required. How lenient is the health unit going to be about this type of a thing?
So our health unit always do that kind of complaint investigation follow-up. We have put out specific guidelines and recommendations for all these businesses to comply for the safety and well-being of all their patrons. So we will be using a progressive educational approach to help them follow the public health guidelines, and our inspectors and our enforcement officers will be out to provide more of a educational approach. But if needed, if there's violations, then we will be issuing tickets and orders to protect our community.
And we did receive calls yesterday and have sent out our health unit staff to attend to those facilities.
Any questions from the Windsor Star?
Yes, I'm just wondering if it's still a public health recommendation that healthcare workers who care for people with positive cases or even public health workers who come in contact with positive cases, if it's still recommended that they don't go to places in the community like grocery stores because of that exposure.
Well, it really depends on what the potential exposures are. I think right now it's the community spread that we have seen a spike. Our recommendation is always to go out when you have to protect yourself and also from others. Healthcare workers, we do understand that they are caring for these workers, but they're also using all their personal protective equipment and gears. And they can also be a good assessor of their own symptoms, and I think that's the key piece. So two things: if they're using all the appropriate PPE, if they have any symptoms, they can make a decision. But generally speaking, I think that it goes to everyone, that anyone who's feeling sick, anyone who has any symptoms, if they're concerned about COVID, they shouldn't be going outside. So the recommendation stays, but not as strong as initially when we were talking about these healthcare workers, that they should just limit their spread to their home and family. But individuals can make those decisions. And I trust that our healthcare colleagues will be in a much better position to assess the situation and make the right choice.
Thank you.
Any questions from CTV?
Yes, good morning. So first of all, do you have any complaints out of day one of phase two?
Complaints?
From the public. Did anybody complain about, them feeling not safe going to an establishment, outdoor patio, anything like that?
We did get complaints about some outdoor patios, and we did send our tobacco enforcement officers and public health inspectors to speak to the owners. But, most of our calls coming into our health unit really are about the results, accessing their test results online. But not a lot of complaints about reopening. I know it's early.
It's early. I figured that, but I thought I'd ask. How about health offices? Are you out in the community right now just kind of checking out the scene to make sure everybody's complying with regulations, or are we kind of just waiting for the complaints to file in and then maybe at some point next week get into the policing of it?
The tobacco and vaping enforcement officers have been out in the community checking out the scene, as you put it, but they are in the community.
Yeah,
okay. And just, sorry, go ahead.
No, I was just saying that's the focus right now. There's obviously two major issues that we are dealing with. One is the agri-farm industry case and containment piece. So our inspectors, public health inspectors, and our nurses are heavily involved in the case and contact management inspection of these facilities, bunkhouses. Our inspectors were out there yesterday with our Public Health Agency of Canada, Service Canada, and our federal partners to go out and about. And the tobacco, vaping, and enforcement officers are doing these site visits for the restaurants and bars and patios to do some of that enforcement. So it is something that we are focusing on right now to educate, to provide guidance. We have produced lots of educational documents for our local businesses, so hoping that they will all review all those guidelines and ask questions, what they have to be better prepared. And in cases, if they need further guidance, our TBO, our tobacco vaping enforcement officers, are providing those recommendations, and we'll continue to work with them because that's the key area. If we want to limit and keep our case counts down, we all have to take part, including our new businesses that are opening up.
Okay, and then just one last one real quick. If there's a violation, what is the dollar amount? Is it the same dollar amounts that you were talking about earlier this week, the $5,000 for residents and what is it, $25,000 for businesses if they weren't wearing masks? Is it the same thing?
Well, right now our enforcement officers are out doing the education and just talking to people, so it's more of an education. If it progressed and there were continued non-compliance, then it would progress to an order. I'm not sure the exact amount, but right now they're really following up and educating and, reinforcing the messaging.
Yeah, and the Section 22 order does carry a high penalty, but the other orders for compliance may not necessarily be as high. But again, the idea is not to penalize anyone. The idea is to make sure that we are protecting our residents and our communities.
Okay, awesome. Thanks, guys.
Any questions from CBC?
Yes, good morning. I was just wondering if there's an update on the joint inspections of bunkhouses in the area that's happening this week.
I'll let Teresa answer that question.
So we did complete the inspection with Service Canada, Public Health Agency of Canada, Ministry of Labour. Our public health inspectors were out the last couple days. I believe they are finished with our inspections at this time, and I think it went very well. We got some good feedback and some great compliments about our internal health unit staff.
Yeah, and just to add that these were joint inspections that were conducted with them, but our inspectors had already conducted more than 800 inspections since the beginning of this pandemic. So I think it just want to make sure that the community is aware that we were doing all those inspections right from the beginning, and we have done more inspection than probably anyone else, close to 800 since the beginning of this pandemic.
Do you anticipate that some of the recommendations that the health unit has made, for short-term and long-term recommendations, do you think the federal government has been open to what the health unit has suggested?
So I think that conversation at this point is ongoing and will continue to go because clearly there are a number of things that we can do better as the country. With the Temporary Foreign Workers Program. So we will be looking forward to provide all those concrete recommendations to help the industry, to help us as a nation, and also to help protect some of these issues that we are seeing right now from an infectious disease outbreak perspective.
And with the mask policy, I know it's for commercial businesses and things like that, but I'm just wondering, as restaurants and patios open, is there an expectation that people should try to wear masks to these establishments as well?
So if you go to our website, so some of those distinctions are made, that which areas that is expected to wear masks, which areas are not expected to wear masks. I shouldn't say expected, required to wear masks, because I think yes. As a community, we should all be using masks whenever we can if the physical distancing cannot be measured. So going back to the restaurants and bars and patios, so when we're talking about any of the outdoor spaces, outdoor patios, they are not required to wear masks. The mask requirement is only if they're going inside the establishment, either to pay or either to do any other type of business inside, then they will be required to wear the mask. When they're outside, they're not required to wear the mask. When we talk about stage 3 restaurants, I think then we'll have to revisit and see, because the idea is not to make it difficult. The idea is to protect individuals. And with the arrangements right now, what we expect from these bars and restaurants and patios is they are physically distancing everyone from the other group. So if a family of 4 or 5 coming together and sitting in that patio, they're already close contacts of each other. So they are not at risk, but they will be at risk if others are close to them. So if others are physically distanced in a better way, that's how you can prevent some of that spread. And when they're in tight spaces, such as indoors, I think they need to be more careful if they're coming in close contact with.
Thank you.
Any questions from Blackburn?
Yeah, I hope more people are going out and about and doing things. Should be really keeping a log of, where they go and who they come in contact with for taking contact purposes.
So that's a good question. I think it's a great idea that everyone, if we start to keep a log of where we are going, who we are meeting, who we are close contact with. There are a number of apps that is currently being built, developed to identify that close contact or connect app. So there are a number of new technologies that are currently being used as well. But I think as in general, it would be more responsible that you know who your close contacts are, and if you can track down some of those details, it would help us in a very speedy movement to contain that if someone develops symptoms and identify their close contacts and take appropriate action to self-isolate them. So it's a great idea that everyone should do it.
And so is the recommendations if you're with somebody for more than what you think was 15 minutes before they're considered a close contact?
That's the timeline that we use to define anyone who is identified as a close contact. But anyone who is living in the same household, by default, they automatically become a close contact. But generally speaking, if you're just having a chat with someone at a 2 meters distance outside for a few minutes, the likelihood is not that high. I think there's been a number of studies also done to see if you're standing apart and then you're talking, what kind of viral load that can come out when you're talking or when you're just passing someone or when you're coughing. So there are different number of risks that people can identify. So more and more research are coming up, but generally speaking, 15 minutes in proximity where physical distancing is not maintained, and that could be accumulative in the short period of time. That's why the key piece is always maintain your 2-meter distance as much as possible.
And it's still like a 14-day window that people could expect to see potential symptoms from is that still used?
Yeah, so basically anyone who come in close contact with, it could take up to 14 days for them to develop symptoms or disease. That's based on the incubation period. But generally speaking, we are seeing cases who had a contact within 6 or 7 days, but it could be as high as up to 11 or 12 days. So 14 days gives a little bit more assurity that if someone didn't develop any symptoms of after a close high-risk contact for the 14 days, they probably did not acquire the disease.
Thank you.
Any questions from AM 800?
Yeah, I just hopefully you didn't go over this already. So if now that part of us is in stage 2, if someone does go for a haircut or goes for a manicure, pedicure, a personal service or anywhere, and they're concerned that they don't feel safe or that there are some errors that the establishment is making, what is the best course of action for that person in terms of reporting it or, making sure that business gets helped out in following the proper precautions?
So one of the things that they can do if they have concern about the businesses and their practices, they can always contact our environmental health line, which is 4475 extension, and then they can make a complaint or ask for our team to follow up. And again, we'll try to connect with the establishment, get more information, and make sure that they have all the right information that they need to safely operate and conduct their business.
Okay, thank you.
Any further questions from Windsorite?
Over the past 3 days, there's been a pretty dramatic drop in the number of new cases at agri-farms. Why do you think that is? Has testing declined in any way, or are we starting to get that area under control?
So a bit of both, I would say. That obviously we are working closely with all the farms that have active cases, and our team is working diligently to get a control, put all these individuals in isolation and prevent any new cases from happening in the first place. So that effort is ongoing. The second piece is obviously we have noticed that there has been a shift in terms of how the testing strategy was being rolled out, and there was some delays in terms of who was being signed up to get testing done. So in one of the farms that was tested, we got some positive. In another farm that we tested, we got mainly negative, like 99% of them are negative. So it's a mix of both. Having said that, the process is ongoing. We still have 176 farms in our region, while the cases that we have seen so far or the testing that has happened, it would still be like close to 30 farms or so that has been tested as of today.
Any further questions from the Windsor Star?
No, thank you.
CTV?
No, thank you.
BBC?
No, thank you.
Blackburn?
No thanks.
AM 800?
No, thank you.
Thank you, everyone. Have a good weekend.